Can I get the benefits of terpenes from edibles? That's an easy one, Josh. Take it.
Yeah, that's absolutely, you can get the benefits from terpenes.
Sure.
As we've spoken during this slide right here, um, we can't guarantee if it's going to add indica or sativa side effects, as in a speed up or slow you down. But what we can guarantee is that those anti-inflammatory and all of those good good effects are there.
I think this slide shows something that's very important, and that is notice the temperature range over here for the different terpenes. When you're cooking, you have to pay attention to that because you can burn off a lot of those terpenes. Is that correct?
Yep. Terpenes are the first thing to evaporate during any type of extraction. So that's why normally you would do a slow run, a condensing run, where we're pulling all those terpenes into a cold trap, collecting those, and then we would go on with our extraction process.
Sure. And so if you're making some edibles on your own, getting above 350 could potentially be a problem. It's better to cook it slower and longer than it is to go forward. But I think more important, that's why I like to buy them, because I don't know if I necessarily get this correct, but I do want to be able to get the benefits from my edible. That's for sure. This is very, very important. Next question is, what's the most rapid onset of administration? I would say probably vaping of some sort. Your thoughts, Josh?
Yeah, definitely smoking inhalation, whether it's flower, concentrates, vape, all three of those are going to be almost instantaneous onset.
Now, I know topicals work pretty quickly as well.
Topicals work pretty quickly. They don't really create full psychoactive effects as much as anything else in the entire edible category due to how they're absorbed through the skin layers.
Mm-hmm.
So usually I would suggest using topicals in addition to your normal regimen.
Right. Good question here is, why is the best way to cook flour in homemade edibles to put in a oil or butter, and why, related to that, are brownies and cakes good edibles? That's right up your alley, Josh.
Yeah, so I actually prefer oils instead of butters because butters separate and you got a lot of extra things that happen if you heat that too much or too fast. So I would always use an oil base if I'm going to do a soak extraction on my plant material, and just make sure you're paying attention to a decarboxylation chart so you can make sure that you're actually getting everything converted into the form that you want.
Yeah, I think that's really, really important. Good question. Why don't edibles work for some and not others? They don't work on me. Related, why do edibles make me feel jittery? I think this has a lot to do with homemade versus manufactured, because in many cases, I think that homemade edibles, getting mixed correctly and getting the right dosage is a real issue, isn't it?
Yeah, it's not only knowing the math for your dosing, but it's also, are you mixing it properly? Are you getting a homogeneous mix? Before you weigh out your cookies, are you putting the chocolate chips in it first or second? Because that's weight that's not infused, so that can displace. If you have one with 10 pieces of chocolate chip versus 3 chocolate chips, you at the same weight, you're going to have more of the product that gets you high with less chocolate chips.
Sure.
As far as the edibles don't work well on me, there are a few instances that we have been able to record of people just not getting high at all from an edible. It's due to the breakdown of how their liver is treating it, and all we can really think about at this moment is that it's overactive of the liver and the enzymes that are created there.
Mm-hmm. Yeah, interesting. And I think when you say it makes you feel jittery, I think that might be the type of cannabis that you're using that creates that particular effect.
Yep, or just slightly too much.
Good point. That's an excellent point. Yes, it is. This question, next one, I can relate to. It says, after surgery for pain management, are edibles as effective as smoking? I'm going to let you answer that, and I have a little comment I want to make, Josh.
So I actually think they're more effective as smoking. Yes, they take 2 hours to kick in, and if you want to smoke a little bit to get that instant relief while those edibles are onsetting, that's perfectly fine. But they're going to give you the longest duration of relief compared to anything else that you can take.
I think it's important to point out that edibles are as effective as effective route of administration as any of the others, including smoking. but more importantly, because it converts delta 9 into hydroxy delta 11, which is basically a much stronger medicine, it sometimes is even better for things like pain. Your thoughts?
Oh, I fully agree with that, sir.
Yeah, I have to tell you, I had knee surgery, a left knee replacement, and I had edibles as part of my regime, and I found them to work very, very effectively. So the answer is yes, and this guinea pig will be the first one to stand up and say, yeah, they do work. Again, make sure you have the right ratios and you have the right products, and again, if you're going to buy it from a dispensary where you can check the COAs to make sure you're getting what you're paying for. Does one type, meaning indica or sativa, make you more hungry, need to avoid munchies? This is always the famous cannabis question, right, Josh?
Yeah, so neither of them make you more hungry. Indica and sativa are both appetite stimulants, so that is a good thing. But when we talk about inedibles, neither of them are going to give that effect. You're not going to have the more hungry effect. What you're going to have is that tastes really good, and I want to continue eating that effect, which is also not a good effect.
Yeah, that's exactly it. I think cannabis, I know in cases where people have cancer and they're trying to fight the offset, I should say not fight, but offset the effects of chemotherapy, cannabis has been very effective to help bring back appetite and basically help them get their health back. Um, Jump on to the next question. Why are edibles lower in THC than other forms of consumption? Your thoughts, Josh?
It's due to how our bodies process them. We don't need as much when you are eating it because it's processing through different parts of your body, and the type of processing is completely different. When you look at smoking with that quicker onset and offset, like that's you need more to get it on the inside of your lungs because of the low amount of contact time that smoke is in your lungs and the absorption rate that you're actually getting from that.
You brought up a really good point, and that point is your goal is really to get relief from using medical cannabis. And you don't need, I want to break the thoughts that more THC is needed. It depends on how that THC, how you consume it, and how it works within your body. And in this particular case, taking advantage of when you eat it, the conversion of delta 9 to delta hydroxy 11 means you don't need as much THC to get the same effects as, let's say, smoking. So that's really, really important. Please explain RSO dosing for cancer. I'm not sure that we're really not trying to give medical advice here on this particular program. And I do have to tell you that dosing is really very individual. This is for individual. You yourself will tell you when your dose is working or not working. Really, a doctor can't talk about that. Now, RSO, and I'll let Josh comment about this. RSO uses whole plant. It can be called full spectrum oil or RSO Rick Simpson oil. And it's very good for cancer because it's bringing a lot of not only the terpenes, but also the cannabinoids to bear, being a whole plant type of product. I should also mention RSO has been excellent for things like inflammation, pain, indigestion, neuropathy. So there's a number of different things that RSO is known for helping in your body. But I think the real issue really boils down to here is that it's something that is very, very important because it's a whole plant product. But being a whole plant product, you also have some materials in there that makes it harder for your body to ingest. Your thoughts, Josh?
I mean, RSO is going to be the same rule as what we were talking about with you're just trying to get as much in your body as possible. You start low, you go slow, and you continue to increase it. As you find you're at a good spot, hang there for a little bit, then try maybe, 10 milligrams more, 5 milligrams more, very slow increments, and work up to get the most amount of healing properties you can at one time in your body.
Sure. RSO is, like I said, is whole plant, and it really works very well. I'm a big believer in it. I know that sometimes when I exercise, I'm into a martial art, and when I kind of overdo it, I use RSO to help me recover. It's something that really, really helps quite a bit. Next question. What is the process for obtaining cannabis products? I suspect you're meaning like here in Florida or in states like Mississippi or Georgia, Alabama, really any state that's out there. I think the first is to try to find a qualified medical doctor. And I recommend a company called Medical Marijuana Medical MMTC of Florida. They have 25 locations that really help you be able to not only get your card, but also they'll help you with your dosing and answer a lot of your questions. But more important, you really want to schedule an appointment with the doctor. That's the first step. And bring your medical records or give them the opportunity or give them the capability to be able to access your medical records. Once you go to the doctor and you go through that appointment, and if you do qualify, you'll be able to be put into what they call the medical marijuana registry. Now, what are we doing here? The state of Florida, and in most of the states that offer medical marijuana, want to have a doctor verify that you have a qualifying condition that qualifies for their state program. That's what the doctor visit is really all about. So that's what he's doing, and he's verifying that you have that condition. That's why he needs your medical records. If you do not have a qualifying condition that does not apply, that you do not pay for that doctor's appointment. In other words, there's no risk to go talk to a doctor to find out if you qualify. If you don't qualify, you don't pay for the appointment. If you do qualify, they'll put you back into the registry. Now, the second part about it is they put you into the state registries. And typically what will happen is you'll get what they call a patient number. In certain states, you'll get it right away, like here in Florida, in Mississippi, in other states, it'll take maybe up to 2 weeks. But you'll get an actual record, which you get that ID, that what they call that registry number. You can actually then go to a dispensary and be able to buy cannabis. And that means that you can buy it in any form, whether it's tincture, edible, or any other form that's really out there. So you really have to have a current medical marijuana card. Typically, those cards last for about a year, and you have to have them renewed. And in order to get them renewed, the states require you to go through another doctor's appointment. I know that they're starting to do some telemedicine now to make it cut the cost a little bit. But the point is, the states do the regulation, and if you follow the rules, you can pick up medical cannabis legally. And hopefully that gives you kind of a quick overview. Again, I'm recommending MMTC of Florida. You can see their web address down here. Josh, anything you want to add to that?
No, I fully agree. Just go with a reputable source, make sure that, everything is up front, and then go visit your favorite dispensary.
Yeah, you brought up a good point, because I know I've been here working here in the Florida system now for about 6 years, and we see people that will offer cards at a cheap price. They go to a hotel room, you get qualified, and the next thing you know, you can't find the person to get the card renewed in 6 months, or you can't get advice as to how to help with medical cannabis. That's why I recommend firms like MMTC, because they do have a dosing center that will help you with your medical cannabis. Any advice for beginners with edibles? I know, how important is it to read the labels? Can you take CBD tinctures with an edible? What do you do if the dosage is not enough? Your thoughts, Josh?
Well, as I said earlier in the talk, it is the most important thing to do is to read labels and to understand what you are ingesting, to understand how many milligrams are there. If you're not reading the labels, then you have no idea what the next 10 hours is going to be. You are fully allowed to take CBD tincture with edibles. It might, knock down the high a little bit, but there's no harm in being able to do that. And if your dosage is not enough, I personally like to wait until the next day and then try a little bit more compared to what I did, and not a few hours later, due to the differences in how the liver breaks it down. Some people are a little slower at breaking it down and getting that onset, and some people are a little bit quicker.
Yeah, that's good advice. Pace yourself. When it comes to edibles, especially, really pace yourself. Don't try to do it all in one day. See how it works. If it's not enough, increase your dosage the second day. The reason I say that is because it takes a while for it to work. You may increase dosage before you have to, and I think that's it'll cost you more for your medicine. Well, first of all, and it's number two, may make you fairly uncomfortable with some of the side effects that you could bring into play. Next question is, I have advanced mesothelioma and I am nauseated all the time. What would work best and fastest for me? Your thoughts on that, Josh?
I would go with a smoke round. So first a little bit of smoking so that you get that instant relief. And then I would look at a either long dose edible, which they actually do have delayed reaction ones that take a little bit longer and they slow release. Or just look at something with like a humulene or a myrcene so that
Yes.
you're getting some of that anti-inflammatory into that.
Yeah, I was going to mention that really the key to medical cannabis is the terpenes, and you were mentioning a couple of terpenes that really can help quite a bit for this. I think beta-caryophyllene is another one that can help with this particular condition. Make sure the product that you're using has that in it. Now, you say, what's the best and the fastest for me? The fastest is inhalation. Now, I'm not a great believer in grabbing a joint and smoking it. I recommend that people use a dry or vaporizer, and the reason for that is because that device allows you to set the temperature. Either that's low, medium, and high, or it's going to be actually to an actual degree itself. I have a Stokes and Bickel, which I can set the temperature right down to the actual degree. But the point is, get a device that you can set that low, medium, and high. It goes back to that terpene table that we showed earlier, so you can get the most out of your terpenes and out of your medical cannabis when you're using this. And I think I would recommend concentrates. I think concentrates work the best. I think they really help quite a bit. They're fairly easy to use. And I know in the case of Cetera, you've brought out a couple of great products recently. Your Galileo products are really good, great concentrates, which you can get in both a vape form and you can get also in a concentrate form. Anyway, I think that's good advice. Question of how many and or what percentage of Americans / Floridians use medical marijuana? That's an excellent question. Lee brought up a great chart here. 831,775 qualified patients here in the state of Florida. I don't know what the exact state of Florida population is off the top of my head, but I do know that in most states, I think there's a talk about in most of the lectures and areas that I see, a lot of states talk about the fact that they look at least 10 to 20% of the population using medical cannabis, and it's projected that will go up to about 1/3 of the population in the United States by the year 2030. Those are kind of some of the projections that are really out there. Medical marijuana is also now available in 37 states. So that's when the states that have passed it. There's a difference between the states that have passed it and the states that have put a program in place. Because, for example, here in Florida, it took them 2 years to come up with the edibles definitions for the rules, even though the medical marijuana was legal. So I would say you're talking, I can't give you an exact number, but I would say somewhere anywhere between 10 to 25% of people that are using it. And it's growing every day. I know that there was a lot of discussion about whether it would be used here in the state of Florida, and I think we're finding out that it is. Your thoughts, Josh?
Yeah, I think that number is going to continue to grow as people are trying to move farther away from any type of opioid-based medicines.
Yeah.
We definitely have issues with some of those things in this country, and going a natural regiment, I think, is the motion we all want to go.
Yeah. Next question, which is again a good question. What is the best gummies for chronic gut and bowel pain? This goes back to the terpene. All right, Josh?
Yep, this is the exact same terpenes that we would talk about for arthritis, and I would be looking at myrcene, pinene, limonene. All of those are going to be very good terpenes to help with anti-inflammatory and antifungal properties.
And what terpenes what products do you have in the Cetera product line that they could use?
So the new Wana line has all of the new terpenes in them, and then our new gel line is our other one that has terpenes. So we do, in our indica-based ones are a myrcene and pinene side, and then you would have a humulene and limonene for our sativa side.
Right, and they would help in this particular situation.
Yes, sir.
Great, that's great. I have type 2 diabetes with a bad case of neuropathy. These two conditions bring on anxiety. Sour diesel helps. Could edibles help? And that another question that was asked, what are the best gummies for anxiety? Your thoughts, Josh?
So I would definitely say that yes, edibles can help. With being a diabetic, you're going to have to pay more attention to the offerings from different companies. Look for a sugar-free option or something like that so that you're not messing with your insulin levels, right, or anything like that. And then the best gummies for anxiety, I would say, are the new 2-to-1 yuzus that are going to come out because they have such a heavy dose of CBD that they are really going to help put that, just take off that edge.
Sure. That higher concentration of CBD will really help quite a bit.
Yep.
So that's really, but yes, the answer is yes, it can really help. Karen asked the questions. Could you tell me if y'all have edibles for arthritis? Josh, that's you definitely have produced some products for that, haven't you?
Yep. So that would be the same SKUs we just talked about. So some of the Wana lines, the indica and the sativa, where you're going to have the myrcene, the pinene, the limonene, and they're also going to be the ones with good inflammation relief as well.
Okay. Next question is Karen asked a good question. What's good for inflammation relief?
That's going to be that exact same thing with that arthritis for you. Myrcene, pinene, and limonene. Those are the top three for any kind of joint pain relief. But one other thing you're going to want to be looking at is some CBN. That's something currently we do not offer yet, but CBN is really good for bone growth and bone density. So that's going to be something you're going to really want to add for that arthritis and joint pain.
That's a good point. Carolyn asked the question, can CBD oil be pure CBD oil without THC? Are they in dispensaries? I think she's talking about broad spectrum versus full spectrum, right, Josh?
Yeah. So, I mean, you have full spectrum in THC also that is going to have CBD. But if you're looking for a pure CBD oil, it depends on what state you're in, because certain states can only sell product in their dispensaries that were extracted through cannabis, and they're not allowed to carry hemp products, which would be anybody in the Colorado area. If you want just TH or just CBD with no THC, you're going to have to buy it from a third-party source.
Right. This is where your CBD vendors. I recommend. We have a CBD store called My Botanical Wellness, which we offer a couple of product lines. One from Maxim, for example. And we also offer broad spectrum CBD oil at that particular store. So it's mybotanicalwellness.com. We'll send an email to you as a follow-up so you can be able to actually follow that as well. Next question is, tell me about meeting this weekend in Florida. I think they're referring to the Cannadelic Conference in St. Petersburg, right?
Yeah. Would you like to cover that one?
I would. I'm going to be attending. I know I'm going to be meeting Forrest, a few other folks. Hopefully you'll be there. It's talking about not only cannabis, but also there's a lot of questions about psychedelics that are there. So this is an opportunity to come in. It really kicks off about noon. It'll go until early in the evening, and it's going to have a number of different, not only vendors, but also presentations that really will help be able to, if you want to take a deep dive into this particular subject, will help quite a bit. And you can meet some of the mad scientists behind the products. Your thoughts, Josh?
Yeah, I think it's going to be a wonderful event. Wana is going to be there giving out some of their CBD-based products that do not have THC in them. Satara is going to be there giving out some CBD chocolate to everybody and have them taste what the chocolate tastes like. So you'd get a little bit of your favorite snacks over there for you. And yeah, it's going to be a good time. I would recommend anybody that's interested in learning more about the cannabis and psychedelic movement to come join in and come see us at the booth.
Yeah, I know there's a lot of conferences that go on. This is one of the ones I really like because it looks like with the way they set it up, you get a lot of your questions answered, and it'll help quite a bit. I think we just put up on the screen here My Botanical Wellness, where you can get your CBD products, for example. I just want to change subjects for a second. This is where you can get your broad spectrum CBDs, which I think helps really quite a bit. Teresa asked a really good question. The nano versus regular edibles, what's the difference? How do you use them? Put it that way.
Yeah, the easiest way to explain the difference is when you break up oil, let's just say you're mixing that into the butter, you might break it into 10,000 little tiny droplets of oil. Each droplet takes a certain amount of time to absorb into your system. With nano emulsion, they're using a stir method to be able to break that down into 1 billion small molecules, which then they're a lot smaller, so they absorb a lot faster. It's quicker. It has a higher ingestion rate, so you're going to actually obtain more medicine instead of burning off more in the liver due to how quick they're able to digest.
Right.
So just more bioavailability, and they feel stronger because you're not used to getting that full effect from it fully. So
I think a lot of your products are heading in this direction. Is that correct?
that is correct, sir.
Yeah. I know that a lot of that, this is a technology and a process that really helps bring more medication to the patients and basically helps them save some money.
Yep. Yep. And it helps that absorption rate. So your absorption rate is going to almost 3x.
Great. Well, listen, I think we answered all the questions. And I don't, do you have any, I want to mention that we have a couple of more webinars coming up on August 2nd. We're talking about Florida's regulations for the OMMU regulations for cannabis. There's a lot of questions about that. How much can you get? How much can you take? That type of thing. We're going to demystify that. And then August 16th, we'll talk about chronic pain and acute pain. And then also we'll talk about anxiety and stress at the end of the summer. So we have our webinar series coming up, and please join us for those, as well as being able to ask questions at those particular webinars as well. I do want to also mention as we wrap up that we do have a YouTube channel. It's called Marijuana. It's called Marijuana Aware. And I think that it's really important to not only look at this video, which is the webinar, as well as the individual video itself, but also gives you a lot of resources that's out there. One person again asked the question of where do I get a card? Medical marijuana treatment clinics of Florida are very important. I think I work with them because they give me the best options for patients. They not only have qualified doctors, they do a great job of training, but they also have a lot of support. I think that's really, really important. So I just want to say, Josh, any final questions or any final comments you want to make?
No, just thank you again for this opportunity. It's been fantastic.
Well, Josh, thank you for your insight. I know having someone who actually makes the products is really, really important. And I do want to thank everybody for joining us today. It's an important subject, and please feel free to, as a follow-up, we'll be sending you an email that has a link to this video. It'll also give you a copy of the presentation in flip book format, the resources that are really out there, and hopefully some information that can help you. Our objective is if we can help just one person get their life back by using medical cannabis, then we feel we've been successful, and hopefully that's you. Thank you very much for joining us. I do want to have a special shout out to Lee and Leah, who do a great job in the background as commentators, to Alyssa Katera, who came up with the idea of this particular webinar. And I thank everybody for joining us. Without you, we wouldn't have a seminar, we wouldn't have a webinar series. And please click and subscribe to our YouTube channel so we can continue to bring you quality cannabis education and stay in touch. Josh, thank you very much. And hopefully I'll see you this weekend.
Yes, sir. Have a good day. Thank you so much.